I chose Thor because of word of mouth purely. The more colleagues that I talked to at a lot of different symposiums and continuing education seminars that I went to, that name just kept coming up. And then also the name James Carroll kept coming up as being one of the leading, if not the leading expert in the world in the field of photobiomodulation. And so I attended a seminar that James had conducted, and he went through a literature review and he explained some of the nuances and the complexities that go into actually manufacturing a laser or an LED diode cluster or just photobiomodulation applications that actually work well. And it's not as simple as what I think other people think it is. And so the NovoTHOR particularly interested me because of the research on stem cell production from the bone marrow and the tibia and the sternum and so on. And it just made perfect sense to just put the whole body in there. The thing that I love maybe the most about photobiomodulation in general, but also the NovoTHOR, is there are no risks and no contraindications. And that, coupled with the fact that it always works, it always does what it's supposed to do. And I can, with all alacrity, I can say that to my potential patients or the people that have been with me for years and years, that they're never going to undergo that kind of therapy and walk away without a benefit. And of course, we have usually a clinical goal we're trying to hit, typically a symptom that we're trying to address. And their worst case scenario is that we miss the target on that particular symptom, but they're still far healthier after going through a series of treatments in photobiomodulation. And I think that anybody, if they do their due diligence and they investigate, they're going to find that Thor in general, all Thor products, and particularly the NovoTHOR, is second to none. There's certainly nobody better out there. And I think that the NovoTHOR being the first whole body application, that was part of my reason too, because I couldn't wait to bring it into the practice, because I knew from my experience using a handheld unit, I could just imagine what was going to happen when I was going to a full body application, or even the combination of those two things. And it's still, at this point, it's still the Rolls-Royce version, I think, of photobiomodulation therapeutic modalities that's on the market. So I can't recommend them highly enough to my own colleagues. And so I've been doing my best actually to try to spread the word, even with local practitioners. I have no concern about competition or anything of that nature. I would really like to see the reputation of the profession elevated by just adding photobiomodulation into every chiropractic office.